Welcome to Human Performance. I'd like to introduce you to our Ergonomics and Corporate Wellness program. Human Performance provides many services. One of those services is continuing education programs. Many of our continuing education programs in biomechanical analysis and functional exercise, injury prevention, and treatment have been approved by multiple state boards of health, physical therapy, and occupational therapy, and other national continuing education programs for physical therapists, occupational therapists, athletic trainers, and personal trainers. It's also been approved by the American Council on Exercise and National Athletic Trainers Association. I've been teaching continuing education courses for all these medical professionals for years. In order for most of these medical professionals to maintain their license, they must get continuing education. So many of these companies will come to our company in order to maintain their license and to learn new and profound techniques in trying to get their patients or clients better. Of course, on the ergonomics and corporate wellness side, we provide successful programs for Walmart, distribution center here in Napa, California, with nearly 1,000 employees, dramatically reduced their injury numbers. Genentech, same. And we've also worked with the city of Vacaville, Fairfield, and Napa. Some of the wineries that we've worked with include Duckhorn Winery, Mumm, Napa, Silver Oak, Farniente, etc. Also Lafitte Cork and Capsule, Petrochem. I've worked with the Navy SEALs, Metrex Nutritional Company, and we have a facility in Napa where we provide ergonomic services as well as personal training, athletic performance, nutrition, and also pain relief. Companies also worked as a strength and conditioning coach for professional and college athletes. Our primary services, human performance, include ergonomics and corporate wellness. So in the ergonomics programs, we typically will evaluate any workstation, whether it's a desk or whether a person's working on a turbine or they're working on loading product on a conveyor belt. We'll evaluate any station, do a biomechanical assessment of what the person's doing and how to improve it, or how to even improve the equipment or purchase new equipment that's more effective and efficient for the person to help improve overall efficiency and to decrease injuries. We also have strain, sprain, joint degeneration, injury prevention programs, which most companies struggle with, and so we obviously provide seminars and workshops for that, as well as media education via DVD, manual, websites, website media design, and production. We also provide injury prevention exercise programs where each department at your business would be evaluated and given a specific program to help them prevent injuries in their specific department, their task, and to maximize efficiency within the company. Corporate wellness programs gets more towards nutrition and general exercise for health and fitness and disease prevention. So we do on and off-site fitness programs for companies, employees, nutrition programs on and off-site, whether it be seminars, individual assessments, prescriptions, complete health assessments from beginning to end, also health club fitness facility design, construction, and management. In order to prevent health and injury problems, first we need to address the safety and ergonomic issues at the company. We need to evaluate those issues to find out what not only the existing nutrition and exercise safety practices are, but also to provide an evaluation program and figure out what is going on. If it's on the injury side, we're looking to evaluate employees' biomechanics, how they move, what they do, how many breaks they're taking, temperature, etc. And with that, we can discover how to vastly improve what the employee is doing to prevent injury, but also to expedite what they're doing and improve efficiency. And with this helps us design a program to where we can implement a proven safety, nutrition, and exercise program for your company. Step one of a safety program is the evaluation. Study the company's injury history by department, study the existing health and injury prevention program, study the company's equipment, and then perform biomechanical assessments on the employees. In addition, examining air temperature, humidity, lighting, glare, surfaces, etc. The next step is to examine the data. So our staff will collect all the data from the evaluation and then carefully examine it to determine what needs to be done with your program to reduce injury numbers or to improve overall corporate health for your company. Once we've examined the data and the evaluation information, we'll make a proposal to your company and we'll present our results. We'll discuss how to develop the program and how to improve your employees, your company's health and safety. The program is developed to gain maximum return on your investment based upon your budget, which doesn't take in effect a lot of money to prevent injuries. The amount of money that's spent on preventing injury is really a drop in the bucket for most companies compared to what they're paying out. Most of the companies that I know of have worked with have about a $50,000 tab on average per employee that have been injured, and will spend far less on providing this entire program for an entire company. Next step of this program is the execution of the program. Managers will be provided with a detailed workshop concerning their role in the company's health and safety program. A program will not work without their approval, so we need to have the buy-in from the managers and all the staff that will take part in this program. So typically we start with the managers of the departments, the head managers of the company, to make sure that they understand what the program is and how to support and develop it with all their associates, fellow employees that they're managing. Once they have that, the program begins to roll out, and then we implement the agreed upon program, exercise programs, nutrition programs, injury prevention programs, seminars. The first usually involves individual or group evaluation. So imagine 100 people standing in a room. Our staff will walk around, usually 1 to 2 people, to do a quick biomechanical postural assessment to figure out a couple of areas of the body are typically associated with arm, neck, shoulder, elbow, wrist, lower back, knee, ankle issues. And that assessment usually takes about 10 to 15 seconds. And this allows us to help customize the seminar to an extent within a group seminar setting, where we provide an initial injury prevention seminar and workshop on how to specifically prevent injuries based upon those workstations at work, looking at pictures of incorrect techniques and pictures of correct techniques, and actually showing these live during the seminar workshop. We also cover exercises that are specific to each department. Hopefully these exercises will either one be done at their home by themselves, or more proven and more effective is actually doing them as a group within their own department at work. So these exercise programs, again, are specific to each department, what their needs are. What a person needs that's throwing boxes onto a conveyor belt, throwing millions of pounds of freight a day, compared to a person sitting at a desk, and what their needs are as far as nutrition and injury prevention are very different. One of the most important components to our evaluation and our entire program is our ability to evaluate your employees and what it is that they do, and having a detailed understanding of physiology, neurophysiology, anatomy, biomechanics, kinesiology, and specifically postural and gait analysis. So in order to determine how to fix what the employee is doing, or even change the workstation, or provide an educational program or exercises for these employees, we first need to really understand what it is that their bodies are doing. And a lot of companies, a lot of people that make injury prevention programs or do this are pretty weak in this area. Usually we'll roll out a very generalized exercise program that's used by the entire staff and is not very specific at all to the individual employee, which is essential because everyone's body has different issues. And so to some extent, without blowing the budget, we want to individualize the program as much as we can, and evaluate each and every employee that goes through the program to some extent. And this would reflect on how they operate at their workstation and what exercises they would do. So in doing the postural and gait analysis, we determine the strengths and weaknesses in the body, and this would be the muscles, the tendons, the ligaments, the joints, the nervous system, and the brain. And with this, allows us to decide upon what it is that the person actually really needs to do. Here's a sample posture, a neutral posture. And so when I look at any employee, or whether I have someone coming through my clinic looking at their posture, their gait, or if I have just a regular Joe or an NFL quarterback coming through, I'm all going to evaluate them the same way. The prescription may be different and will be different, but I evaluate them the same way. So you can see in this picture of a neutral posture, this is what people's posture should look like. And in order to prevent injuries and to treat them, this person must get back into this neutral posture. Our goal in building an ergonomics workstation or building an exercise program, it always comes back to getting the body back to this neutral functional posture. So we see these physics lines going through the body, and all they depict really is where the body is supposed to be. We notice the feet are parallel, palms are facing each other, the hands are directly at the side, the ear is directly in line with the shoulder, the hip socket, knee, and ankle. I would say 99+% of people that we evaluate in companies and the people that come through our clinic, including athletes or average Joes, have a poor posture, nothing near this. And it's these poor postures that lead to injury, performance issues, breakdown, lack of energy, and with this can affect every system of the body. Our company's partnered with and done some work with a company called Vicon, who makes postural analysis software and equipment. They basically use infrared cameras with these infrared balls on the body to help us identify postural problems and the physics that occurs during poor posture and ergonomics. So in this particular pictures, which you have video of, you'll see a person lifting a box, and so these are all force plates under the person, and these cameras are measuring all the angles at every joint in the body. So it's allowed us to really help determine how workstations should be designed and the forces that are incurred upon the body when lifting or doing various activities. So we've done a lot of scientific research using the most state-of-the-art equipment to determine how best to help prevent and treat injuries. Here's a sample of a pretty regular posture. Actually, not bad in the feet, but everything else is a pretty standard poor posture. We notice at the head, we notice a little orange ball there depicting upon a postural landmark. So all these little orange balls are postural landmarks where the string that you see, called plumb and line, should line up with these orange circles. So we can see in the first picture on the left that the head does not line up with that. The acromioclavicular joint, the AC joint, the shoulder that's frequently injured, is not in line with that. We also notice that the third knuckle should be in line with that, and it's not. The knee is not, and the ankle is. If we go to the far right picture, we notice more of the same. If you look at the center picture, we'll notice that the hands rotate in. The palms should actually be facing each other. So that person has close to 75 degrees of internal rotation. The hips and knees are in actually pretty good alignment. But again, something like this is an injury waiting to happen, and certainly the person's strength and endurance is greatly compromised. Their performance is greatly compromised based upon this posture because the amount of energy that it takes and the damage that actually incurs on the Here's another sample of a neutral posture. And so now we're going to get more into the energy expenditure and trying to develop reasoning for why looking at posture is so important and gait is so important in preventing injuries at the workplace. So if we look at a neutral posture for a person that weighs about 200 pounds, the energy that is expended is roughly 40 calories. And the amount of muscular force that it takes to maintain the body at the fourth lumbar vertebrae, basically the lower back, is 176 pounds. And that is also 418 pounds to maintain the body in a neutral posture at the ankles. Now here's where this becomes fascinating. So if we look at essentially a person that's the same size, we look at their posture, and this is a very typical posture that we'll find in the workplace and just in our society and the Western modernized world as it is today. So if you start looking at the feet on the left picture, we'll notice the feet are severely pronated or turned out, the knees are turned out, the hands are rotated in, the right shoulder's dropping low, and the center of gravity, the person's chin is leaning off to their right considerably. We look at the side picture, side view, we notice the head's forward, the arms forward, the hips forward, and all of this causes great distress on the muscles, the bones, the ligaments, and the joints. So we can see the amount of energy that it takes to actually just stand in this position is 300% higher compared to the first picture. And the numbers for maintaining force, equal posture, and being able to stand at the fourth lumbar vertebrae and the ankles are double, nearly. 352 pounds at fourth lumbar vertebrae and 836 pounds at the ankle. So when you're looking at these kinds of forces, you start to wonder if these forces can injure the body, or is it what leads to injuries. And so now you start thinking about exercises and muscles and how we mitigate these issues, how to design workstations, how do we create exercise programs that will help develop a stronger core and eliminate these postural issues that we're seeing that are the primary reason for strains, sprains, and joint degeneration. Here's another sample posture of a collegiate athlete, football player, and we can also see in here that the person has issues with head alignment, shoulder, forearm, hand, pelvis being tilted forward, so an extreme position to get injured in any of those areas, whether it be neck, shoulder, lower back, ankles, knees, hips. This person is carrying an excessive amount of load in the wrong way and not using the muscles how they're meant to be used. We can also see this in this athlete's shoulder, that the right shoulder is down nearly 1.5 inches, and thus loading his entire weight, approximately 40 to 50 pounds off to his right side, thus placing a lot of pressure on the supporting structures such as the spine on the right side, the hip socket on the right side, the knee, and the ankle. All this is fixable barring major injuries, design changes, or genetic defects. All of this is treatable through proper exercise program and education. These imbalances or postural issues tend to occur from excessive use, typically from excessive use of particular muscle groups. And when you overly use one muscle group, it tends to turn off or deactivate and make the opposing muscle group dysfunctional. So in this example, we look at the chest muscles, otherwise known as the pectoralis major, and its antagonist muscle, or the muscle that has the opposite function, more or less, is the rhomboids and trapezius muscles in this sample photo here. And so what will tend to happen, as you've seen in the last photos, is the head tends to come forward, the shoulders and the hands tend to roll forward due to an overactivity of the biceps and the chest muscles, which causes weaknesses in the upper back. So this can be addressed through giving the person exercises to help offset these problems, which causes injuries and performance problems. And also updating or reworking their workstation, or reteaching them how to use their workstations so that they do not incur an injury on their body. Here's another example that we look at with lower back injuries, knees, hip problems, degenerative issues where we see strains and sprains and degeneration of joints. One of the biggest issues that we notice in trying to prevent these issues or treat them is an imbalance between a muscle group called the psoas major. It's a lower back muscle that starts in the thoracic and lumbar area and inserts into the lower upper thigh bone. And this muscle is typically used in raising the legs up or doing, say, like a full sit-up. So it's a very important muscle. It's also known as a postural muscle. So in it having a postural function, it's an endurance muscle that only fires really during work against gravity when you're standing. And then we have the gluteal muscles, the gluteus maximus, antagonistic muscle to the psoas major. It has an opposite function to that muscle, and it tends to weaken and lengthen and become flaccid. So the psoas tends to get overly used in what most people do at work, and the gluteal muscles tend to get weak, and that creates an imbalance which tilts the pelvis forward and tends to cause excessive curvature, what we call lordosis, concave curve in the lower back, which leads to lower back problems. So the exercise program would help to balance this out to mitigate pain and prevent injuries, as well as increasing performance. Typical problems that we notice here are sciatica. That's a very common problem that we'll notice. Femoral nerve pain, general just lower back pain, hip socket pains, any pain around the knees or even the ankles. So it's one thing to have a strained muscle or tendon, or to have an injury to a ligament, which is known as a sprain. It's another to have degeneration to the joint. So the long-term postural deficits, postural misconfigurations, and problems with the posture and gait not only lead to muscular problems and ligament problems, but it also leads to more damaging problem to joints, where you've got a cartilage that covers the end of most joints, and known as hyaline cartilage. It releases something called a synovial fluid, so it allows the whole joint to really operate smoothly. Kind of like oil in a joint in a car. It helps lubricate it so there's no problems while the muscles are trying to move the bone around. Well, if it does that excessively in the wrong way, it starts to wear out that joint and no longer allows the body to produce the synovial fluid, and this all, in essence, will lead to pain, which is very difficult to cure, to really treat. There's some things that you can do, but once you've really worn out the joint, these days typically you'll see some form of full joint replacement or partial joint replacement to help mitigate those problems. So once you've kind of gotten there, it's a little too late. There's some stuff you can do to ease the pain, but a difficult position to get into. So if we prevent ergonomics issues at the workstation, get the person to do their exercises accordingly that are specific to their body, they will prevent these problems and thus improve your bottom line and not have the injuries and help out with your insurance. Here's a quick look at some vertebrae, looking at joint generation again. If the person's not bearing weight properly over their spine, which all the pictures I've shown in the past, the people were not, and so we can kind of see what happens when you're asymmetrically loading. You're not loading weight properly over the vertebral disc, as we see here on the left. It starts to compress, and that compression starts to tear away at the structure of the disc. And that outer structure called the annulus fibrosus, and the little cheesy stuff in there, the disc, is called the nucleus pulposus. What happens is that annulus fibrosis tends to tear, and that nucleus pulposus, the cheesy stuff inside, will start to get outside, protrude, and start to place pressure against a nerve possibly, and thus causing a compression problem in it and causing pain or referred pain or radiating pain. And over time, if this continues to happen, the joint will start to wear out. And you can see in the picture on the right, a 20-year-old versus a 60-year-old. You can see the disc space differences between the two, which also can be hydration issues. But I've seen 20-year-olds that have discs that look like the 60-year-old. And I've also seen 60-year-olds that have healthy discs that look like the 20-year-old in this picture. So we want to prevent these problems. Just taking a look at a few examples of workplace safety. We tend to take pictures and video if possible, can't at all workplaces, but we try and do that to help make the best and most effective training manuals and training presentations and website presentations for learning purposes, injury prevention purposes for your employees and for your company. And so with this, you can also see that we'll take evaluation data from this and measurements and how these people are doing their work to find the most effective position for preventing injury and increasing efficiency and improving your bottom line. Here's a sample of an employee doing an improper lift. So of course, when we're making these videos and pictures for presentation purposes, educational purposes, we usually film them in a safe way, performing the task properly and improperly. So we can see in this particular version, using the employees and the local faces around there, make the presentations more interesting and more personal to your company. Here's a sample of the same employee conducting a lift correctly, or as close as possible. And so again, we're taking video and pictures of all these things to incorporate into the manual, the presentations, and to help identify how we can improve the person's biomechanics, ergonomics while they're performing any duty at work. Again, as in the last two pictures, we can see an employee doing his picking of the grapes and pruning correctly in this video picture. And doing it incorrectly. So again, we like to take pictures and video of them doing correctly and incorrectly for training purposes, educational purposes, injury prevention purposes. So whether it be working in an industrial environment, in a distribution center like Walmart, which we do, or working in vineyards at wineries, we can work in any environment and evaluate literally any particular task. Now, we've been talking about ergonomics and we've been talking about injury prevention. Now we get into more of the corporate wellness side and how we take a look at those programs. And this is very brief. So when we're designing a corporate wellness program, we're looking at helping people with their cardiovascular, their strength programs, their flexibility programs. These are some of the things that we will do in order to obtain data and our exercise prescription. Our goal always is to prevent disease and live a high quality of life without injury or disease. And so obviously we'll look at cardiovascular prescription and evaluation. So typically with these people we'll do aerobic testing, whether it be at the business or our facility. We use different scientific methods in order to determine what the person's aerobic ability should be and what it is currently. Helps us determine what their program should be, which will help us design their intensity, duration, frequency for their exercise program. In strength, we'll take a look at functional testing, of course our postural and gait analysis, and then we'll address those musculoskeletal misalignments to the strength program, whether again this be for a pro athlete or a regular person. But these must always be addressed as part of the flexibility, strength, or cardiovascular program. And then, of course, it must address the employee's specific job. Do we really want a guy that's doing, or a gal that's doing 8 hours of hard physical labor to go do more aerobic and more strength work? Typically that person's going to lie more in doing flexibility style program to help balance out their body to prevent injury and to also feel healthy and happy. Flexibility, we'll typically do the gait and postural analysis, some functional testing to help determine what kind of program that is that the employee might need, and then we'll address those musculoskeletal misalignments as part of their general health program. There's a lot of testing that we do, such as body fat, blood pressure, EKG, and health history, doctor's information that we'll utilize, if possible, to help design the ideal cardiovascular strength and flexibility program for a group or an individual set of employees. In a corporate wellness program, we're doing nutrition. Obviously, we usually do a lot of education with that, whether it be seminars, cooking seminars, workshops. There's a lot that we can do to help create camaraderie and an educative environment, a healthy environment for the employees. So in order to produce a really effective nutrition program, we have to get the health history, the blood pressure, doctor's reports, body fat, weight. Anthropometric measurements are nice to have, but not totally necessary when designing a nutrition program. So we like to collect as much data as possible, which will make our prescription a lot more accurate for the nutrition program, and a lot more efficient. want to identify the essential nutrients in the human diet. So what most people don't understand in the nutrition program and educating them is what are essential fats, essential amino acids, essential vitamins, essential minerals, how much water should I be drinking. So these are the basics that people need to learn to understand as part of nutrition. What is it that the human body actually needs to have? Not necessarily what it wants. I want to cook your piece of pizza. It's not what you should have, but it's what you want to have because it sounds good. So educating people on what are the healthiest things that they need to be eating. We'll do this through fun seminars like making smoothies and dueling blenders, where each employee's got a blender and they're making their own smoothies or making sushi rolls. So they'll learn in many ways, not only through seminar format, but in practical education in making their own food and how they should eat. People learn to read a food label. A lot of people don't know how to do that, how many calories they should be eating, and associate that with how to read a food label and calculating their actual needs during the day. Most people don't know this. And another big topic that we focus on is the difference between organic and non-organic eating, those types of foods and rules and regulations that most people would not know, but due to government regulations and government information data they probably don't have access to. So we give out the basics here so that people have a very strong understanding of nutrition and what it is that they're supposed to be eating, how they're supposed to do it, and give them specific evaluations, if possible, in their nutrition program. We also teach employees how to navigate a grocery store, how to make healthy smoothies, soups and salads, healthy snacks, how to make and what is a healthy breakfast, lunch, and dinner, and how to cook them. That's part of not only the seminars that we do, but also part of any supporting information that we provide in manuals or on websites specifically for your company.